let's start with the basics, okay? So why is healthcare costs such a big deal in retirement?
You know, it's one of those things that if you don't plan for it, it can just erode the purchasing power of all of your retirement assets. And these are monies that you worked hard for. I mean, it's vacations you didn't take, it's overtime, you didn't see, little Timmy's play because you had to work, or you didn't get to go to that one game because you were working overtime. I mean, this is money that you worked hard for. So we want to make sure that we have, as part of your plan, at least some sort of money allocated for healthcare costs. And, people are living longer. My family on my mom's side has longevity. My grandmother was 95 years old when she passed away. And she had, I think, 6 siblings, and they were all older than 92 when they passed away. So number one, I'm going to be here for a while, just so you know. But also, I have to plan for that. And I better make sure that I don't have any gaps in my coverage, and that everything is laid out, and I've got some sort of plan to account for it.
Yeah, well, Megan, you said a really good point, and that is people are living longer, right? And so I think one of the things we have to keep in mind is the expenses of healthcare. So why are so many people underestimating the expenses of healthcare?
I think a lot of people just don't know what to expect from healthcare. They feel like Medicare is going to cover everything. They feel like somebody else it's never going to happen to me, right? I'm not the one that's going to have a healthcare crisis. Somebody else is going to have it. So they also think that Medicare might be covered, or long-term care might cover Medicare. I don't really know where there's enough education out there for our families. So that's what we're trying to do, is make sure that we educate our families on the different types of expenses that they might have and how they can have coverage for it.
And speaking of healthcare expenses, what comes with that is also prescription drug cost, right? So like as you are growing and getting older, there's medicine involved, right? Like there's other expenses that you have to kind of factor into that plan. And so let's talk about the rising prescription drug costs that could also play a role into planning for retirement.
So when you get to Medicare, which by the way isn't as simple as just going in and saying, oh, I'm going to check the box for me and my spouse or me and my family to have coverage. You have to actually go in, and Medicare is a whole different plan in and of itself.
Yeah.
And then you've got to talk about Medigap coverage or a Medicare supplement, or you might go down the Medicare Advantage route. Well, then you're talking about which plans cover what. Then you talk about all of these healthcare expenses with prescriptions. Well, that's Part D. And again, something completely new that you have to learn about once you get to age 65 and over. But that is your prescription coverage. So it's not that prescriptions are free, but you get this plan so that prescriptions don't cost maybe as much. But then it's all built around the medications that you take. And who is stagnant as far as their healthcare in retirement? Nobody. If I have something today, well, this medication's the best, and then next year I get something else and that medication is best, or there's a new medication that's going to come out that we don't even know about yet, and all these changes continue to happen. And so we have to keep up on those plans to make sure that it's got the right coverage for the lowest cost, and that's something that is so critical, so important, but we have to make sure that people have a plan for it. And there's going to be times when things change and things pop up that we don't know about. So you better have enough money and your different emergency funds to be able to cover it.
Right. And Megan, when I think about Medicare and healthcare, you think about the ABCs, right? There's so many different layers and names.
I don't know what you're talking about. Part A, Part B.
It's like, where do I start? And also, I know a lot of people are questioning what is right for me. And so as you have people come in and clients that you meet with, how do you determine which pathway is best for them?
That's a great question, Danielle, because there's not a one size fits all. There's not everybody that comes in our office does this or does that. And I think a lot of it is going to go back to, how do you live your life? Do you like to travel? Are you more of a stay-at-home type of family? We have some people that like the Medicare Advantage route, but that's kind of like going down the route of, more of an HMO type of feel, and there's out-of-pocket expenses, and you might not be in network, and so that might not be a good option for people that travel. We also might have people that want the Medicare supplement because they'd rather have a consistent bill coming in every month, like a supplement expense, and then not have to have a big expense that they cover. And so it's, how do you live your life? how do you manage your spending plan, and what might be the right option for you based on your health history. And everybody is going to be a little bit different. And so I think the biggest piece of it is you have to come in and sit down with us. We have people in our office that are focused on Medicare, that understand the rules and regulations and all the changes that happen in that world, because it is a full-time job, right?
Yeah.
And so let us walk you through the ins and outs of it.